The University of Maryland medical system recently announced a major change that could encourage greater racial parity in healthcare. The hospital system, which comprises numerous facilities across the state, says it has eliminated race as a factor in birthing decisions, a concept that has historically been part of a national standard.
Many of these approaches are archaic and are historically rooted in bias and discrimination.
Dr. Joseph Wright is talking about an algorithm that uses race to calculate whether a woman is best suited to have a normal birth after having a cesarean section.
I had a C-section. This was my first delivery, so it wasn't expected. We did try to have a vaginal birth, but I wasn't dilating.
It's pretty common. Yeah, it's not abnormal for a first-time mom to have a C-section.
Under the old algorithm, Black and Hispanic women would traditionally have a lower score, making it highly probable that they would have subsequent C-sections, surgeries which are considered major operations.
Historically, this has come from a place where it was felt that the pelvic architecture for women of color was less suitable for vaginal delivery, which is insane.
Dr. Wright says that theory is not rooted in any kind of science. It's just a biased assumption about non-white women. That's why the University of Maryland medical system is retiring that algorithm in its 13 facilities. They're replacing it with one that doesn't use race and ethnicity as modifiers in that decision-making.
The American College of Obstetrics and Gynecologists has not only removed race and ethnicity for Black and Hispanic women from the calculator, but have incorporated chronic hypertension, which is obviously an important clinical metric.
I would still want to opt for a C-section the second time.
The new algorithm may not change Amani Cruz's mind, but nurse Danielle Austin thinks it's a great idea.
I think it's awesome because a lot of times in our minds, we are going to have a vaginal delivery, but sometimes it doesn't work out that way, but that gives them the second chance to try again. So it's great.
Dr. Wright says his office will be studying the impact of this change and how providers are applying the new tool. In February, the healthcare system removed race as a factor in determining where people of color are regarding chronic kidney disease. That algorithm change is also being monitored to see if it impacts where Black patients are on the kidney transplant list. He says there are still many other race-based calculators that need to be eliminated.